Today I'm here to talk to you about the top 5 reasons that you want to make sure that you're as healthy as possible before you do any type of elective surgery. Now, elective surgery is just that, elective, which means you have the luxury of time to make sure that you're healthy before you go under anesthesia. Now, I know what you're probably thinking is that, you've seen this on TV. You watch the consultation happen, there's a commercial break, and then the surgery's happening, another commercial break, and the person's home happy and healthy. And, this is reality TV, which means there's definitely some liberty that they take in presenting to you what really happens. So kind of let me go over the truth of the matter, is that you need to take some time to prepare yourself and your body, both mentally and physically, to have surgery done. So even though it seems really easy and it seems like it's not a big deal, it really is a big deal, because if you're unhealthy, what's going to happen is you're going to expose yourself to higher risks of complications, and on the worst end or extreme, you might even end up in the hospital. So let's review the 5 reasons you want to make sure you're healthy as possible first. Before I start, I want to tell you that I've done thousands of surgeries myself, and I've helped patients through this, and I've seen firsthand what a huge difference it makes if someone's healthy or unhealthy before they undergo surgery. In fact, when I had my own surgery done, I felt really healthy, and I even thought to myself, why should I go to a doctor? But I'm really glad I did get checked out before I had any type of surgical procedure done. So I really believe in the success of having a procedure is really just as much due to how well your body is mentally and physically prepared for having surgery, just as much as the actual surgical procedure itself. So let's go over risk number 1, anesthesia risk. Anesthesia is generally very safe, and when you undergo anesthesia, if you're healthy, the chance of anything bad happening during your anesthetic is just as likely as you getting hit by lightning on the way home today. So it's a really low risk, but your chances of having complications or problems goes up the more unhealthy you are. And so anesthesiologists actually have a classification system that they call the ASA classification system. ASA stands for American Society of Anesthesiology. And they rank people 1 to 6, 1 being you're super healthy, no medical issues, and 6 being that you basically are no longer living. Somewhere in there is your ranking. And you want to make sure that you're at least a rank 2 or a 1 before you undergo elective surgery, if at all possible. So a rank 2 means that you have a mild systemic disease such as diabetes or pre-diabetes, maybe high blood pressure, but the key is that you work with your doctor to get it under control. So for a diabetic, for example, your hemoglobin A1C level is less than 7, or if you have high blood pressure, your blood pressure 20s and 130s systolic. If your blood pressure is really high, like over 140, or your hemoglobin A1C is over 7.5, those are all indications that you have a systemic disease that's not under control yet, and you really need to work with your doctor first before you have the surgical procedure done and before you even see a surgeon. Now, if you're a class 3, it's going to take some time for you to get yourself into a class 2. So make sure you're telling your doctor, where you need to be before you have surgery done. Reason number 2. The more unhealthy you are, the longer your recovery is going to take. Now, studies have shown that you will have more pain, you'll be unable to move around as much, and it'll take you longer to move around, and you might add days or weeks to your recovery if you have some sort of medical diagnosis that is uncontrolled, or you have an undiagnosed medical issue. So the key here again is to make sure you see your primary care doctor, make sure they do a full physical exam, which usually includes an EKG and some blood work, before you have any type of surgical procedure done. In fact, the likelihood of you ending up in the hospital after a surgical procedure also increases the more you have an uncontrolled medical problem. All of this can be avoided if you see your doctor before surgery. Reason number 3, you have a higher risk of healing problems. Plastic surgery, more than any other surgery, relies on your body's ability to heal itself. So if you have an undiagnosed medical condition or a medical condition is not under control, you actually have less blood flow to your skin, and you have a higher risk of that skin not being able to heal in the areas of incisions. When this happens, you have what's called an open wound. And that open wound, bring it to its extreme, can actually become necrotic, which means you have some skin that doesn't survive the surgery, or you can have an infection. So once again, big reasons to make sure that you're healthy enough before you have surgery. If you're healthy, the chance of you having an open wound decreases exponentially. If If you're unhealthy, however, say you're overweight, you're diabetic, you have high blood pressure, you have some sort of unresolved medical issue, the chance of this happening goes up. Now, what happens if you have an open wound? Well, you have to treat it with what's called dressing changes. And dressing changes are where you have gauze and you put gauze in the wound 2 or 3 times a day. Sometimes you have to have a nurse come to your house to help you do this. It's basically something that you don't want to go through if you don't have to. Sometimes as open wounds, they will eventually heal, but they can lead to infections and they can lead to bad scarring. And that can mean that you might need to have another surgical procedure to remove the scar. So once again, making sure all your medical problems are under control will really help to make sure that you have a successful result after your surgery. Reason number 4 is you have a higher chance of infections when you undergo surgery if you're not healthy. So once again, when you have a surgery done, your body needs to have its immune system totally intact. And if your immune system is not intact and it's weak, for example, this makes you more prone to infections. Generally, the risk of infection is about 1% or less when you have any type of elective surgery that's done under sterile conditions. But if you're diabetic or pre-diabetic, you have a higher risk of having infections. So get your medical problems resolved before you have a surgery to avoid infections. Reason number 5 is you could have a major complication after your surgical procedure. So one of the major complications that surgeons are always worried about is what's called a DVT. A DVT is a blood clot in your leg that travels to your lung potentially and what causes a pulmonary embolism. If you get a pulmonary embolism, it shuts off your respiration, which means you basically can't breathe. This means that you usually will end up in the hospital and for many, many days, maybe even in the ICU or even worse. So you want to make sure you avoid getting a DVT after your surgical procedure, and the way you do that is by walking around 3-4 times a day or even more, just to make sure you keep your legs active so they don't develop that clot inside. However, the more unhealthy you are, once again, not having treated diabetes, high blood pressure, heart disease, or obesity, you have a higher chance of getting a DVT. And once you get a DVT, you also have a higher chance of that DVT turning into a pulmonary embolism. So get yourself as healthy as you possibly can and talk about your DVT risk with your doctor before you undergo surgery. In California, we actually have a law that prevents us from doing plastic surgery unless you've had a physical exam beforehand. This was due to the untimely death of rapper Kanye West's mother, Donda West, after having an extended surgical procedure done and she not having appropriate medical examinations done in the 30 days before her first procedure. So we like to always send someone for a full medical evaluation before having surgery done, and there's a link below to tell your doctor all the things that we generally need in clearance for your surgery. Thank you for watching 5 reasons you should be totally healthy before you undergo elective surgery. If you have any questions or comments, I'd love to hear them in the comments below, and I'll try to answer all of them as soon as possible. I'd also like to ask you to please subscribe to this video series. I'm going to have many more videos that are very important to anyone undergoing any type of elective surgical procedure. Also, buy the book, 10 Reasons to Consider Before Having Plastic Surgery, on Amazon or Barnes & Noble or anywhere you can buy books. And finally, feel free to go to the website virtualconsultation.com if you would like a surgical consultation for any type of cosmetic plastic surgery procedure with myself. Thank you.